Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 23rd of February 2022. Our COVID inpatient numbers have gone up a little bit since last week, and today we're showing 73 COVID positive patients in our hospitals. That is patients who are within 10 days of their first positive diagnosis. And of those, we've got 67 patients in our general beds in Blackpool, Victoria, with 2 patients in critical care and 4 patients at Clifton. That increase is somewhat at odds with the gradual decline in community prevalence that we're seeing, such that the Blackpool figure shown today is 304 per 100,000, Fylde is 272 and Wyre is 307 per 100,000. And a reminder that back in January, those figures were in the order of 2,000 per 100,000. So the community numbers are coming down, although, of course, the amount of testing going on is coming down as well in the community. So we need to bear that in mind. So the number rising in hospital is important. We've seen quite a lot of COVID positive patients coming into hospital, often with COVID, but actually presenting at hospital for other things. So the COVID is, in a sense, an incidental finding in that case. But we've also seen, I'm afraid, some hospital acquisition of COVID. In other words, patients who have come in COVID negative have then become COVID positive. And we always analyse the reasons for that with every single patient. And we do think there is a correlation with us reopening visiting. So the conclusion there is that sometimes the COVID has been brought into hospital by visitors. I think that's an inevitable consequence of opening up the flow through hospital, but it's why we must reiterate our request to everybody to make sure anyone visiting is asymptomatic when coming to visit, ideally has done a lateral flow test beforehand, which is negative, and to abide by our infection prevention and control rules when in hospital. So there are masks, as you know, at the front of the hospital. We ask people to wear those throughout and to observe our other internal regulations. So although things loosen up tomorrow from February the 24th in terms of it would no longer be a legal requirement to isolate if someone tests COVID positive, of course, from a hospital's perspective, we strongly recommend that is the case. And testing, free testing, remains until the 1st of April. So for the next 4 or 5 or 6 weeks or so, the testing regime remains unchanged, and it's such an important part of staying on top of this. So if you think you have any symptoms consistent with COVID, which are essentially flu-like, cold-like symptoms, then please do undertake a lateral flow test. And if that is positive, to get a PCR test done. And all the details are still on the NHS UK website and through dialing 119. So that's a kind of message about, although things are changing in society, as it were, it's still a big issue within hospitals. Our emergency department has remained extraordinarily busy through this time, as have all others. And of course, we are still testing everybody for COVID and segregating patients accordingly. But the busier the department gets, of course, the bigger transmission risk exists. And so although we have increased and opened up our visiting arrangements, we do still ask for restrictions as far as visiting in ED is concerned for exactly that reason. And the fine print, the fine detail of all those arrangements is on our website. I'm sorry to say we've had 12 additional deaths in the last week since I last spoke, which are linked to COVID. So COVID has occurred within 28 days of the patient's death. So commiserations as ever and condolences to the families of the loved ones involved. Again, I stress COVID may not have been the cause, but is certainly part of the story and therefore is captured in the certification. So I've talked about testing, I've talked about visiting. Vaccination still remains the big thing. And I think we're starting to see in the media, aren't we, suggestions that another COVID booster program is likely to emerge, perhaps later on in the year, and the details of who will be in and out of those groups is not clear. But our vaccination hub remains open, and Dr. Raj Pura, who's the Director of Public Health for Blackpool, was telling me that the vaccination bus run by Blackpool Council is still in operation and actually delivering a high number of vaccines. So there are still ways to get vaccinated. We still think it's the most important and effective way to reduce personal risk and help support our society in emerging from this condition. So I still urge people to go ahead and do that if you haven't already. Meanwhile, as things loosen up, I think we all have to make our own minds up about how we deal with the risk. But I'm getting across a hope that from a hospital perspective, we still see some people who are really very, very poorly with COVID. Sometimes they are not immunised, so that's a big issue for us. And I think we can all do things to help reduce the risk. Thank you.